Hello everyone, and welcome to my channel. Today, I would like to share a brief update on hepatology that is relevant to primary care. I'm talking about a shift in the nomenclature of what was previously known as non-alcoholic fatty liver disease to a more apt term, metabolic dysfunction-associated fatty liver disease. In this video, I will delve into the research behind this terminology shift and why it holds greater relevance, particularly in primary care. Understanding this change can significantly enhance preventive strategies for patients with multiple risk factors. So, let's dive into the details. This change was highlighted in an article published in February 2023. I'll link the article to the description below. Non-alcoholic fatty liver disease is a condition characterized by an excess accumulation of fat in the liver without significant alcohol consumption. NAFLD, as it is often called, is associated with being overweight and having other health issues such as high cholesterol, diabetes, and high blood pressure. One of the shortfalls in making this diagnosis is the reliance on patient-reported alcohol consumption to determine significant alcohol use and the need to perform exclusionary investigations. Bear in mind that the histopathological picture of fatty liver is the same in both alcohol and non-alcohol fatty liver disease. So how effective has this NAFLD terminology been in identifying patients at risk of advanced liver fibrosis? Recent research suggests that it has not been as successful, and this new terminology called metabolic dysfunction-associated fatty liver disease, MAFLD, holds a better promise in terms of directly calling out the notable pathophysiology for the development of fatty liver disease, without excluding other causes of fatty liver or abnormal liver enzymes. The research suggests the following criteria for diagnosis to include the presence of fatty liver usually noticed on ultrasound imaging in the presence of one of these features of metabolic dysregulation. From a clinical and primary care standpoint, the new terminology, MAFLD, directly highlights the typical discussion we have with patients who we suspect to have non-alcoholic fatty liver disease. During our history-taking, physical exam and blood test review, your primary care clinician would have gathered all these parameters listed in the diagnostic criteria for the new terminology MAFLD. We also know that cardiovascular disease is the most common cause of death in people with NAFLD, and whether the term changes to this new metabolic dysfunction-associated fatty liver disease, this continues to be true. The researchers who are championing this nomenclature change notably suggest that it is much better at picking up the most susceptible patients to these cardiovascular complications, particularly in the presence of comorbidities like hepatitis. This will be very resourceful in primary care, where time and resources are limited, allowing the clinicians to target interventions to the patient group that needs the clinicians the most. The overall benefit of tackling metabolic dysregulation has implications for reducing morbidity and mortality in other diseases, including cancer prevention. The metabolic dysfunction-associated fatty liver disease terminology allows for joint diagnosis with other causes of liver disease that may be found out during the exclusionary tests of the previous NAFLD terminology. The researchers have, however, expressed caution to adopting the new terminology. They cite that these changes will affect patient clinical endpoints in clinical trials that are already ongoing, which are likely to be different depending on the nomenclature you choose. Furthermore, they highlighted that there will likely be difficulty in evaluating the efficacy of candidate drugs in clinical trials. This is the case where the drugs that target inflammation or fibrosis may not have any impact on addressing metabolic abnormalities. But as primary care clinicians, while we wait for the new terminology to be accepted globally, it should not detract from our commitment to continue to use evidence-based medicine and shared decision-making to address metabolic dysregulation, which is a leading mechanism for significant cardiovascular complications, cancer, and mortality. Thank you for watching. Don't forget to like, share, and subscribe to the channel for more educational videos like this.